Okay, welcome back, you guys. This is part 2 of should I break my virginity or not, should I start having sex or not, wada, except I'm gonna title it being HIV positive in brackets in pregnancy. The reason I'm gonna put in brackets in pregnancy is because why? What did I say? Oh, because HIV is the same, but like I want to emphasize it more in pregnancy because it's quite important. It's very important, né? Okay, so here we are. Something I wanted to check. Okay, what's up, guys? Welcome back to my channel. I hope you guys are good. I hope you guys are great. I hope you're doing good in this level 1 of lockdown. Remember, level 1 of lockdown, so we still have COVID-19 in our country. Doesn't mean it's gone just because now we're on level 1. They just economically letting things a bit more loose, but it doesn't mean that the virus is completely gone. I mean, look at the weather today. It's so cloudy, and that's where COVID-19 now starts to perish and enjoy the moment. Anyway, sorry, enough blabbing. Like I already said, now I'm just going to talk about HIV, especially in pregnancy. Yeah, maybe I should just say HIV, especially in pregnancy. So first of all, what is HIV? HIV is human immunodeficiency virus. So what basically happens is that, okay, let's start with how do you get HIV. So HIV is that's what it stands for. How do you get HIV? So HIV is transmitted in a lot of different ways. The reason I'm emphasizing pregnancy is because there's what we call mother to child transmission. So basically you get your HIV from your mother, né? So you can get it that way through pregnancy, from your mother. You can get HIV through being in contact with blood, especially as healthcare workers. I don't know how many times I've found blood on my hands or anywhere in my body without even being aware. When you're a midwife, chances of you having blood everywhere, especially also in casualty, like being a midwife and also in casualty, chances of you having blood somewhere in your body without knowing how it got there are extremely high. That's also another way you can get HIV. And by blood, it can also be through needles, sharing of needles, especially people who use drugs or people who do background stuff that are related to medical, because they don't have supplies, so they can simply use a needle and then just wash it and then use it on another person. And I forgot the name of the thing that's supposed to be used to clean up like, well, you know, when you go and cut your hair, especially males, when you go cut your hair, they clean gas spirit. Apparently the spirit doesn't kill the virus. So if I get cut and I have HIV, can be transmitted to the next person. But also when it comes to HIV and blood relation, there needs to be a certain amount of blood that gets into the person's system for the HIV to be able to get there. Anyway, that's your blood. So that's your mother to child. Your blood can be through sexual contact. So through sexual contact, you can also get HIV. So that's how you can get HIV. And I'm sure you've noticed that all of those things are related to your fluids. So sexual contact through fluids, not blood, but like bodily fluids, reproductive system bodily fluids, and other types, which is your mother to child, and your blood is basically your blood, right? I hope you guys got that. So that's how you get your HIV, which is why I want to talk about HIV today. So now you know what HIV stands for. You know how you can contract HIV. Now I want to go a bit deeper into what HIV itself is. So people who are HIV positive are probably familiar with these terms: your viral load and your CD4 counts. So viral load, remember, HIV stands at the end, that V stands for virus, is a virus. So what it does, I'm going to try to explain it in a simpler way and not like medicalize it and make it long, because like the whole pathophysiology of it is a lot. So I'm just going to try and simplify it for you guys. So what happens is let's say Ntlantla and Masego have sex. Ntlantla leaves the virus on Masego's genitals. Now, when it gets there, it starts to multiply. Ne? So it's a virus. It starts to multiply. It's like, yeah, I got into the body now. I'm gonna cherish, not cherish, what's the word? Perish. No, it's perish. But like, yeah, I'm gonna thrive. I'm thriving in my soul's body now. Yay, I'm getting busy. So it multiplies, keeps multiplying, keeps doubling. There's 2 of them now. 2 of them make 2 more. They become 6. 6 of them make, they keep multiplying, becoming more and more. And they start accumulating in your bloodstream. Now you find them in your bloodstream. You find them in the lymph nodes. You find them all over your body, basically. So they're busy multiplying. That's how they end up attacking other cells. While they're multiplying, they keep killing your CD4. CD4 count. Your CD4 cells are your immune cells, ne? Your how the soldiers of your body. So soldiers mean that those are the cells that fight for you. When you get an injury like me, I don't know, not that I don't know what happened, I got hit by a gate. So when you get something like this, they come and fight so that infections should not go in. They're already there fighting. That's why you get the swelling, ne? I don't know if you can see, I'm a bit swollen now. So they come to fight. You guys, infection, you better not walk in. So what HIV does is it kills the soldiers. So basically, they come and actually kill the soldiers on your body. So let's say Zimbabwe and South Africa are fighting. What happens? People from Zimbabwe the soldiers from Zimbabwe come to South Africa to come and kill South African thingies. Or I don't even know what example to use. So basically, your HIV comes in and it kills those cells, and that's how it multiplies. So that's where you get your viral load and your CD4. Viral load, when your viral load goes up, your CD4 count goes down. Because it means the viruses are multiplying and killing more and more of your CD4 counts. Hence, your CD4 count goes down. So those are the terms that a lot of people, they hear about it. They've just been told that, oh, your viral load is now lower than detectable. Or your viral load is now 5,000 copies. Or your viral load is now, you get people who have viral load, 15,000. So you get they get those terms, but they don't have it in them to ask, what is this? I get a lot of patients who I'm just like, okay, you know what a viral load is? And they'll be like, no, but they've had HIV for 3 years of their lives. So as healthcare workers, I'm also asking you guys to try and explain such terms to your patients, because a person will know it's okay, viral load, sure, it's on 5,000. I don't know what that 5,000 means. And once it's there, then it's high, because when we give ARVs, we try to keep viral load below 50. That's when we say it's it's lower than detectable. Ne? So that's your viral load and your CD4 count. So that's basically what HIV does to your body. And that is why I always try to tell people that HIV doesn't kill. What kills is opportunistic infection. So what HIV does, it kills your CD4 count. It kills your soldiers. Now your soldiers are weak. So when TB comes, what happens? TB out, and you know the different types of TB. There's pulmonary TB, there's extra pulmonary TBs. I found out about a month back that there's abdominal TB. Is it abdominal? But yeah, the TB that's in your GIT. There's like TB can occur everywhere in your body. So that's what kills you. Opportunistic infections, your TB, your pneumonia, your this, your that, your all these things. They're the ones that kill people, not HIV. So when you have HIV, you can live. You can be looking at me now thinking I'm HIV positive. Negative. You'll never know. You can't just look at me and say, Masero, you are positive. You are negative. But the moment you don't take care of yourself, trust, healthcare workers, I can literally walk in the streets and just be like, this one has HIV. I'm sorry. But yeah, it's possible. So all you have to do is to get tested, be diagnosed with your HIV, and get treatment. And I know I'm saying it as if it's as easy as that. It's not. I'm not gonna lie, it's not. It's a lot of strain to you. Now you have to start taking medication each and every single day of your life. When you go to groove now, you need to know it's 8 o'clock at night, I have to take my meds. When you have to go for functions and stuff like that, 8 o'clock at night, you have to take your meds. So it literally does change your life. It does. And also you now have to start telling your partner that I'm HIV positive. You get a new partner, I'm HIV positive. It's a lot. Psychologically, emotionally, it's honestly a lot. I will not lie. But let's make this thing a norm. Let's treat it like your cardiovascular things. Let's treat it like diabetes. People are able to just tell you that, oh, I have diabetes. It's an illness. People can tell you I have cancer. And me personally, I'm more scared of cancer and diabetes than I am of HIV. Because, cancer and diabetes, guys, those are the worst. Like, diabetes, you'll be buried with half your hand, half your legs. And with, what's this, cancer? The pain that comes with cancer is literally the most excruciating pain ever. Look at me talk like I know. But yeah, I've seen patients go through all their pain and stuff. And it's something that I would never even wish on my worst enemy. Anyway, so my point is we need to normalize HIV. We need to normalize it because I myself can get it from Ntlantla. I myself could have gotten it from my mother. I myself could have gotten it from needle pricks as a nurse. I myself could have gotten it because I was involved in drugs. I myself could have gotten it because I was kidnapped by, like, now Nigerians are kidnapping South Africans and they probably give you drugs. So now they gave myself a drug. She has HIV. She got it from Ntlantla. And now they're giving you the needle. So you're going to get HIV too. So you don't know where the person got HIV. Awuyazi. So stop judging people. Stop looking at people and thinking, wait, no favor during your times. That's why you have HIV. It's not like that. No one chooses to have HIV. No one wants to have HIV. No one just walks in and runs into having HIV. That is why I'm making this video, so that you guys make conscious decisions so that you don't end up having HIV. And as mothers, you prevent your babies from getting HIV so that they don't have to go through that. I always say, as a woman, you got the chance, you were born, you got the chance to be HIV negative. You were born HIV negative. So why not give that poor little soul, that innocent soul, an opportunity for them to actually be HIV negative for once in their lifetime? I mean, chances are you got your HIV from your, I won't say poor decision making, but like from your own mistake. I don't know if you get me. I chose to sleep with Ntlantla without using protection. Ntlantla didn't put a gun up to my head. Now that I'm HIV positive and I'm pregnant, I need to make sure that I prevent my baby from having that virus because it's really not fair. It's not fair. Give that baby a chance to live their lives as HIV negative people. If they make mistakes along the way, it will be their mistake. Me have some water because like my throat is dry. Yeah. So that's basically what I'm saying. And while at that, it's very important to be honest with your healthcare worker. It's very important to be very honest with your healthcare worker so that we can get to the bottom of the problem. Like if you have multiple partners, we know now, okay, this one has multiple partners. It's very important for you to test every 3 months to make sure that, is it every month now? I think they changed it to every month. Because HIV, I can get HIV today, sleeping with Ntlantla, I get the virus. When I go test, it's negative because it hasn't really multiplied to a point where it shows. I don't know if you get me. So it's still multiplying. That's what we call the window period, which could be 3 months. So after 3 months, that's when it's now detectable. That's when they realize, okay, actually, you are HIV positive. So being honest with your healthcare worker is very important, especially with regards to STIs and STDs and your HIV, because now we know how to go about with things. Like the other time I had this lady, she was pretty old, and I was like, okay, so in the file that we fill in, this other one, it's a personal file for where I work at, it asks how many partners you have so that they can see the risk of you getting HIV or STIs. And she lied. She was like, 1 partner. I can see when you're lying. I'm so good at seeing people lie. Even niggers can't lie to me these days. So I'm good at noticing that this person is actually lying to me. And I told her that there is really no use of you lying to me because honestly speaking, I see so many patients in one day. I ain't got no time to look at Ntlantla and be like, Ntlantla, I saw you at my job today. Remember you told me you have 5 partners. I don't care about the boyfriends that you have. If you have 50 boyfriends, they are yours, not mine. So you just need to be honest with me so that I can know the chances, the risks of you getting STIs and HIV. So you need to be very honest so that people know what way to take, especially when you are now sick, you have skin problems. That's how stage 1 presents. Is it stage 1? Yeah, stage 1 of HIV presents. It starts with your skin infections, skin what we're seeing that you have that, but you lie and you're saying you only have one partner, and it's a right to say no to HIV testing. But if you have one partner, okay, you can get HIV from one partner, but you lie. I have one partner, I'm always using protection, da 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 da. There's no need for you to lie. I don't care about the people that you're sleeping with. I care about your health. So if you tell me you have so many partners and wara, I can give you the right guidance. I can educate you properly. I just wanted to take that out of my chest. And then also, yeah, when it comes to lying, guys, I'm sure my voice has changed even because, wow. When it comes to lying again, mothers, it is your responsibility to ensure that your baby comes out or is born HIV negative. It's very possible. It happens. We see it. And the moment a baby is born, we take their bloods, we check, and the baby is HIV positive. Yo, it breaks my heart. It gets to me. It gets to me because, yo, I feel like I'm gonna cry. I mean, it's not a personal thing. It's just, it gets to me because when I look at that child, I feel like crying because now this poor baby has to, when they decide to get intimate and stuff like that, they now have to go and tell all their partners that they're HIV positive and get judged and stuff like that. And stop judging people, please, guys. Anyway, it's your responsibility to make sure that your baby is born HIV negative. Reason being is because also mothers lie to their babies. Mothers lie to their babies. Maybe Ntlantla didn't go out to sleep with another girl. Maybe that's not how I end up with HIV positive. With HIV. Maybe Ntlantla was born with it. And they were giving him medication every single day, but they told him it's for his heart. It happens. It happens. And when you take Ntlantla to go test with you before you guys engage in sex, it's negative because the person has been on medication his whole entire life. And then it says it's negative. And then I go and sleep with him and then I end up with the HIV because the mother lied. When your baby is old enough, sit them down. Explain to them what's going on. But one thing that you shouldn't do is to don't make the baby look at you like you're a terrible mother, because you're not. I don't think there is a mother who would literally just be like, yeah, tata na HIV, tata veli tata. I don't think a woman in their right minds would. So if you feel like it's hard for you, take them to a clinic. Take them to a clinic so that they explain to them what's going on. So they don't end up... Some mothers end up passing on without telling their babies they're HIV positive. Now the baby's no longer going to take the ARVs because they were told they were for their heart. And they realize, it's like my heart is fine, man. There's no need for me to take those medication. And then now the baby starts getting crazy sick, and then they find out they're HIV positive. That time the poor person has never been engaged in sexual practices, has never had any contact with blood. Now they don't understand how that happens. That's very depressing. It's a lot for the child. You get your 16-year-olds who come HIV positive and pregnant. They only find out when they're pregnant that they're HIV positive because it's part of the routine. And please be honest. Do them that favor. Do them that bit, because eventually they'll find out. And you don't want your baby to always be sick from opportunistic infections just because they're not taking their ARVs. Please, 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 and please. There's something I wanted to talk about as well. Okay, so how do you prevent your baby from being HIV negative? Now, $1 million question. This video I think is going to be very long. Or just long, rather. Over 30 minutes maybe. But I hope you guys bear with me. How do you prevent your baby from getting HIV? First things first. When you know that you're HIV positive and you're planning to have a baby, don't just stop using protection. You need to go to the clinic and find out what your viral load is. you need to go to the clinic and get advised on when you shouldn't use protection and when you should use it. You need to be taken step by step when it comes to planning for a baby when HIV positive. Now, Ntlantla and I could both be HIV positive, both taking medication. The moment we stop using protection, he has his viruses, I have my own. Sometimes you think Maso is taking her meds, she's probably not. But the main fact is that we exchange viruses, and that's how I will be taking my medication every single day at the right time, every single time, but my viral load shoots up. It's 5,000. You don't know how. It's because you're not using protection. So when you're HIV positive, protection is a lifetime thing. Now, HIV negative, positive, protect yourself. Always use condoms unless you're planning to have a baby. Ne? So that's the very first important thing. When you're planning to have a baby, you need to consult. When you're HIV positive, you need to go and consult so that you end up with a healthy baby. Right, awesome. That's the first thing. If you're given a go ahead and you got all the advice that you need, all the education that you need, all the information you need, now you're pregnant. Woo, yay! Choop, choop. Now you are coming to maternity, to my side. Ooh, ooh, you're gonna give me. I'ma be a midwife. I'ma book you for your pregnancy. Ooh, 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 ooh. I'm a terrible singer, I know. Anyway, find out that you're pregnant. Now we come and book you. When you find out you're pregnant, when you see you missed your periods. Every time I ask my patients why they booking late at your 30 weeks, Barry, they were not sure they were pregnant. When you miss your period, don't you go to the clinic? Don't you go to a doctor or some? Do you sit at home? Is your home a clinic? Is it a clinic? Is that how you'll know you're pregnant? You go to the clinic and tell them, I miss my periods. I don't know what's going on. I had unprotected sex. I miss my periods. Sign of pregnancy. So that we can test your urine and see, are you pregnant? Why are you missing your periods? Do we need to get you into a hormonal therapy vibe? Or, so if you find out you're pregnant right then and there, we book you, mtagabao. And when you're HIV positive, you can start we can start monitoring your viral load, your CD4 and stuff. Make sure that your baby doesn't end up got HIV, ne? And also, like I always say, it's very important to start taking your supplements because actually you're supposed to take them before you even fall pregnant. So when you're planning to fall pregnant, we'll even give you the supplements and the information you need. When you find out you're pregnant, you come back immediately and we can book you and make sure that we take your bloods as regular as we're supposed to, following maternal guidelines, South African maternal guidelines as to when and how to take bloods when it comes to checking the viral load to pregnant women and stuff like that. And the ARVs that we give to you, there's a new drug that came about. I think they started it last year. They started giving it to patients last year. It drops your viral load within 4 weeks. It drops it like bam. It drops it. So if you find out that you are pregnant, your viral load is lower than detectable, meaning is less than 50 copies, we can switch you to that thingy, dolutegravir, which is the new drug, and we'll make sure that your viral load stays there. Or if we detect HIV, if you book early, that's very important that you book early. When you book early, we find out that you're HIV positive, then we can get you into that dolutegravir at the beginning so that we make sure that within 4 weeks, your viral load is squashed and the chances of your baby getting HIV are very low. So here's the thing. HIV positive mother, to prevent your baby from having HIV, before you fall pregnant, get medical advice. When you're pregnant, come and book early. If you know yourself as HIV negative, you'll never know that you're positive until you get tested. So if you know that you are HIV negative, immediately when you fall pregnant, come and book because we're going to test for your HIV. If you find out you're HIV positive, we'll be able to prevent your baby from getting HIV by giving you the right medications to drop your viral load to as low as possible. That's how, like, when you take your medication, it closes up the virus. So multiply going to different parts of your body. So when it's enclosed there, it doesn't end up go into your baby, so your baby ends up being HIV negative. That is why it's very important to book early. Please, guys, book early. Okay, so that's another thing of preventing twin. So another agree, it's booking early. It's getting medical advice when you're HIV positive. It's booking early, whether you're HIV negative or positive, so that if you are, we can get you on the treatment immediately. The third thing is taking your medication. Take your medication. Adherence is very, very important. Take your ARVs, guys. If you take your ARVs at 8 o'clock every day, take them at 8 o'clock. The reason being is, I don't know if it'll make sense to you guys. Like I said, HIV, when you're taking ARVs, it closes the HIV. I get HIV when you get it spreads. But when you start taking ARVs, so when you supposed to take your medication at 8 o'clock, remember, it's 24 hours. It's 24 hours lifetime. Is it time? What do they call that? Half-life thing. Yeah, situation. So it means the pill contains it for 24 hours. So the moment you miss a dose, now, when that hole opens, the virus starts coming out. So it's very important for you to take your medication every single time. Every single day at the same time, so that this thing keeps on being this closed. The moment you miss one dose, this is what happens. Now you're opening one hole for the thing to come out. Ne? Got that? So, first thing, I keep going back because this is important. First thing, when you're HIV positive, you're planning to have a baby, come get medical advice with your partner. Secondly, book early. Immediately when you find out you're pregnant, come and book so that we can do the necessary things, whether you're HIV negative or positive. Thirdly, if you're HIV positive, then you need to take your medications at the right time every single day. Fourthly, use protection every damn time. Every time, use protection. I don't know if Ntlantla is taking his meds or not. I don't know if Ntlantla is sleeping with someone else who's also HIV positive, gets that HIV, and then he gives it to me. Now my viral load is going up high, even when I'm on dolutegravir, which is the best drug that is found, that decreases your viral load just like that. So you must make sure you practice safe sexual thingies every single damn time. And fifthly, your visitation. I cannot emphasize this enough. It's very important to be adherent to your visits. If you say come Kari 20th August, don't come on the 15th of August or on the 50th of August. Come on that date. There's a reason we want you to come on at that time. Like I said, we follow maternal guidelines. We know that at this time you're supposed to take your VL, you're supposed to take your research, you're supposed to take this, you're supposed to take that. So if you don't come on that date and now your baby is born, nothing could have been done. We didn't realize that your viral load was crazily high. Or you come at 35 weeks. It's here. You're pregnant, like you're really pregnant. Your baby has been moving. Your baby has eyes, it has ears. It can hear you talk. Your baby is fully developed. You come to us. We find out you're pregnant. You are HIV positive at 35 weeks. Chances of your baby getting that virus are extremely high. Crazingly high. Very, very high. Very high. So those are the 5 things that I expect women who are HIV positive to please do in order to prevent their babies from getting HIV. It doesn't end there. Once the baby is now born and we do the PCR test, which is the HIV test that we do in newborns, we find out that your baby is now HIV negative. Yes, that's what we wanted. Yes, that's what we wanted. Now, the main thing that we need to do is to make sure that it stays that way. For it to stay that way, that's where breastfeeding comes in, what we call exclusive breastfeeding. Now, this doesn't only apply to HIV positive women, it's for every woman. But now I'm touching bases on HIV pregnant women. So what happens is when you start breastfeeding, it lines your baby's stomach, your baby's intestines. So because it's protected now, it's not going to get the virus. So the moment you start adding water or food or whatever, it scrapes off that protection, making your baby vulnerable to viruses, including the HIV itself. Now, if you're giving formula and breast milk, it means that formula wipes off the breast milk that lined up the baby's mucosas, and now the baby's prone to HIV because now you are also breastfeeding. So the baby's gonna get the HIV from your breast milk. I don't know if I'm making any sense. So it's very important that when you start breastfeeding your baby from day 1, 6 months, you don't give anything. You do not give nothing. You don't give nothing. After 6 months, your baby would have had their own immunity. They will be now strong. They will now be strong. And remember to continue following the adherence, taking your medications every day, and also having safe sexual practices when it comes to breastfeeding. Because the moment you now start having crazy sex and you don't use protection, your viral load goes up high, chances that your baby is going to end up getting HIV from the breast milk are extremely high. So please, let's do the right thing, bazalwane. Tla re tseng dilo tse dintseng sentle tleng, tla re thusaneng, re tshwaraganeng, re tlogele go jajana tleng batho ba modimo. Ke go ba re rataneng jaaka re le bana ba morena. Ke a le kopa tlhe, wetse o naganele ngwana gago, o naganele motho mo pele ga gago. Le tlogele go nna ntse le gwarana ka HIV. HIV ke virus, bathong ke bolwetse, bo tshwana le diabetes, bo tshwana le bolwetse ba pelo, bo tshwana le asthma, bo tshwana le eng. So please don't judge other people. And when you're HIV positive, bruh, good person, good human being. The main point is for you to live each and every day, and you might be driving a Mercedes-Benz G63, my favorite car, or you might be driving your i8. Nage busy yeah, HIV, like a driver HIV positive. Oksalayo, nalwana, we're living literally the same lives, whether you're HIV positive or not, whether I'm HIV, we're literally living the same life. The only thing that I have to do is to take my pills every day, and the only difference between us, that's literally the only difference between us, because everybody's supposed to use protection. So use protection while doing that. Anyway, peace out. I love you guys so much. You guys know that. I love you. I love you. So please love yourselves enough. Oh, actually, I have discovered that I keep telling my patients to use protection. And then I realized that not all of them can, because they are married to men who are going to tell you that they ain't going to use protection. So it's also a very important thing. You need to be able to discuss this thing with your partner. I don't even know how to go about this whole topic, but oh guys, inzima le topic lena. You would get a lady who has an STI, and the guy's like, I'm not going to use protection with you, but he knows that he's busy messing around. Men ain't shit. That's why I always say, when you get involved in sexual practices, you need to know what kind of a nigger you're getting yourself involved into. If the relationship is abusive like that, leave. Like I said, men always put themselves first. To let us learn from them and put ourselves first as women. Okay? Anyway, that was very random. Anyway, that's it from me, guys. I love you guys so much. I really do love you. Please just stay safe from coronavirus, from HIV, from STIs, from STDs, and do make sure that your babies are safe at all times from this virus, because it's very possible to give birth to an HIV negative baby even if you and your partner are HIV positive. I love you guys so much. Enjoy the rest of your day. Don't forget to like this video, give it a thumbs up. This is a good video. If you don't give it a thumbs up, I'm thinking anyway, guys, please do give it a thumbs up, hit that notification button, and please do press that red button, press subscribe. Just subscribe, okay? Subscribe. This is literally free information. I'm not getting anything from this. I don't get paid for this. I just do it because of passion, darling, of passion. Anyway, bye guys. Don't forget to follow me on all my social media platforms. You will get them on the description box. Bye.